Hello viewers, welcome to Health Matters with Dr. Deme Dennis. Today we'll be looking at hypertension, the silent killer. We will look at the classification, the possible causes, complications, and then the management. High blood pressure is one of the most common worldwide diseases that is afflicting humans and is a major risk factor for stroke, vascular disease, chronic kidney disease, etc. Hypertension is defined as a systolic blood pressure of 140 millimeters of mercury or more, or a diastolic blood pressure of 90 millimeters of mercury or more. So if you've ever had your blood pressure measured, you discover that it's recorded as two values, the one above and the one below. The one above is known as the systolic blood pressure, and it checks the pressure in your blood vessels when your heart contracts. And then the diastolic blood pressure checks the pressure in your blood vessels when your heart is in between contractions. Globally, an estimated 26% of the world's population has hypertension, and the prevalence is estimated to increase to 29% by the year 2025. Now let's look at the classification of hypertension. Based on the recommendations of the 7th report of the Joint National Committee on Prevention, Detection and Evaluation of High Blood Pressure, the classification of blood pressure is as follows. We have the normal blood pressure, that's the systolic that is lower than 120 millimeters of mercury, and diastolic that is lower than 80 millimeters of mercury. There's the pre-hypertension, that's systolic of 120 to 139, diastolic of 80 to 89. Then the stage 1 hypertension, systolic of 140 to 159, diastolic of 90 to 99. Then the stage 2 hypertension, systolic of 160 or greater, diastolic of 100 or greater. The classification above is based on the average of 2 or more readings that is taken at each of 2 or more visits after the initial screening. What are the possible causes of hypertension? Hypertension may be primary, which may develop as a result of environmental or genetic causes, or it may be secondary, which has multiple etiologies. The primary or essential hypertension accounts for 90 to 95% of adult cases, and a small percentage of patients have a secondary cause of hypertension. The pathogenesis of essential hypertension is multifactorial and complex. Multiple factors modulate the blood pressure, including circulating blood volume, blood vessel elasticity, neural stimulation, etc. The natural history of essential hypertension evolves from occasional to established hypertension. After a long invariable asymptomatic period, the persistent hypertension develops into complicated hypertension, in which end organ damage to the aorta, small arteries, heart, kidneys, retina, and central nervous system is evident. The secondary causes of hypertension. Some of the causes of secondary hypertension include polycystic kidney disease, chronic kidney disease, steroid use, brain tumor, alcohol, nicotine, pregnancy-induced hypertension, oral contraceptive use. Now, approximately 5% of women taking oral contraceptives may develop hypertension, which abates within 6 months after discontinuation. What are the complications of hypertension? Some of the complications of hypertension include heart failure, ischemic heart attack, chronic kidney disease, hypertensive encephalopathy, etc. The management of hypertension. Many guidelines exist for the management of hypertension. Most groups, including the GNC, the American Heart Association, and American Stroke Association, recommend lifestyle modification as the first step in managing hypertension. GNC 7 recommendations to lower blood pressure and decrease cardiovascular disease risk include the following, with greater results achieved when 2 or more lifestyle modifications are combined. Weight loss. So these are the lifestyle modifications that should be put in place in order to reduce the cardiovascular disease risk and to lower the blood pressure. Then limit alcohol intake. Reduce sodium intake to no more than 100 millimole per day. Maintain adequate intake of dietary potassium, and there are many fruits with high potassium content like banana, orange, etc. Maintain adequate intake of dietary calcium and magnesium for general health. Stop smoking and reduce intake of dietary saturated fat and cholesterol for overall cardiovascular health. Engage in aerobic exercise like jogging at least 30 minutes daily for most days. The American Heart Association and the American Stroke Association recommends a diet that is low in sodium, high in potassium, and promotes the consumption of fruits, vegetables, and low-fat dairy products for reducing blood pressure and lowering the risk of stroke. If lifestyle modifications are insufficient to achieve the goal blood pressure, There are several drug options for treating and managing hypertension, but you need to visit your physician so you could be properly evaluated and placed on medications. In conclusion, most individuals diagnosed with hypertension will have increasing blood pressure as they age. Untreated hypertension is notorious for increasing the risk of mortality and is often described as a silent killer. Hypertension is a lifelong disorder. For optimal control, a long-term commitment to lifestyle modifications and pharmacologic therapy is required. Therefore, repeated in-depth patient education and counseling not only improve compliance with medical therapy, but also reduce cardiovascular risk factors. Thank you for your time. Stay informed, stay healthy. Kindly share this video as well as subscribe to my YouTube channel or like Facebook page at Health Matters with Dr. Demedenis. Thank you.